Report on the intersection of state single-payer healthcare systems and workers' compensation. Introduction. The discourse surrounding the implementation of state single-payer healthcare systems in the United States has intensified, raising significant questions about the future of workers' compensation. Advocates for single-payer systems propose a centralized healthcare model funded through taxation, aimed at simplifying access to medical care for all residents. However, this discussion often overlooks the intricacies and protections provided by existing workers' compensation systems, a cornerstone of the laborer's grand bargain. This report addresses the necessity of integrating considerations for workers' compensation into the conversation about single-payer healthcare, emphasizing that eroding the foundational elements of the laborer's grand bargain does not serve the interests of labor. The laborer's grand bargain and workers' compensation. The laborer's grand bargain refers to the century-old social contract between workers and employers, wherein workers forfeit their right to sue employers for workplace injuries in exchange for guaranteed, no-fault insurance coverage for work-related injuries and illnesses. This system is designed to provide swift and fair compensation to injured workers, covering medical expenses, lost wages, and rehabilitation services. Impact of single-payer systems on workers' compensation. Medical care integration. A single-payer system could streamline the provision of medical care, potentially simplifying the process for injured workers to receive treatment. However, this simplification risks overlooking the specialized nature of workers' compensation, which includes considerations beyond immediate medical care, such as long-term rehabilitation and return-to-work programs. Indemnity and administrative challenges. While a single-payer model might reduce overhead for medical care, it complicates the administration of indemnity benefits, compensation for lost wages, and long-term disability. The distinct mechanisms of workers' compensation for determining compensability and coordinating care could become muddled, undermining the efficiency and effectiveness of benefits delivery to injured workers. Erosion of worker protections. Advocates for single-payer healthcare must recognize that any reform that inadvertently undermines the workers' compensation system could erode critical protections for labor. Workers' compensation not only addresses healthcare costs but also encompasses employer liability and the broader social safety net designed to support workers injured on the job. Any dialogue on healthcare reform must, therefore, include a thorough consideration of workers' compensation to ensure that labor protections are not diminished in the pursuit of broader healthcare access. Need for comprehensive reform. Proposals for single-payer healthcare systems at the state level must include explicit provisions for the integration or coexistence of workers' compensation. This includes maintaining the distinct advantages of workers' compensation, such as coverage for work-related injuries, disease prevention initiatives, and employer incentives for maintaining safe workplaces. It is crucial that healthcare reform does not inadvertently bypass the unique aspects of occupational health and safety legislated through workers' compensation laws. Conclusion. The movement towards state single-payer healthcare systems presents an opportunity to reevaluate and potentially reform the way healthcare is delivered and financed in the United States. However, this movement must not proceed without a concurrent examination of workers' compensation systems. Ignoring the complexities and protections offered by workers' compensation risks eroding the laborer's grand bargain, which has long served as a critical component of the social safety net for American workers. True labor advocacy requires a holistic approach to reform, one that enhances healthcare access while preserving and strengthening worker protections under workers' compensation. This dual focus is essential in ensuring that healthcare reform benefits all stakeholders, especially labor, without sacrificing the foundational principles of workplace safety and compensation for injuries sustained on the job.